What's a harder sell, I think, for a few of the senators, Dr. Hyman, is he doesn't understand the science or the role of it. And yeah, he's right about food and what's in it, but everybody knows that. And HHS is a much bigger job, and he's not up to it. What is your perspective on that?
Well, thanks, Chris, for having me. I think this is a historic moment. You know, we need to address the chronic disease epidemic that's crippling America, that's driving up healthcare costs to what I think $4.9 trillion. 40% of that's paid by the government, almost $2 trillion. We're seeing our children suffering like we've never seen before. 38% of teenagers are now pre-diabetic. This didn't exist when I graduated from medical school. We are facing a national security crisis because our members of our youth are unfit to fight. 77% get rejected. Globally competitiveness, we're being threatened because of the chronic disease epidemic, because kids are 31st out of 37 countries in math. So we have a crisis, and never before in a presidential race nor in an administration has anyone taken on the burden of addressing our chronic disease epidemic and all that goes with it. Now, you may not agree with all of his policies, you may not agree with all his views, but I know him, and he is not anti-vax. He is clearly pro-science, and he's got a very ample and nimble mind that is able to actually sort through and look through the data. And I've been deep in these conversations with him. So I think people have a lot of misunderstanding about it. I think he tried to clarify that in hearings today. But I think we have to sort of understand that we're in this moment that we cannot miss, which is finally, and me, I've been shouting from the rooftops for 30 years, finally, we have this moment where the nation can face this problem together and try to solve the problem of chronic disease together.
Douglas, are we mistaking goals, priorities, wants with the realities of what this job is and what Bobby would be able to do, especially when one of the things he said today was that, look, I'm going to do what the president tells me to do. So is there a belief in your mind that he can achieve anything ambitious?
Well, he's going to have to fold in, which he has with Make America Great or Make America Healthier Again or whatever you want to call it. He's desperate to get confirmed now. Bobby Kennedy Jr. has been a long haul of campaigning, and it's maybe down to one senator, Senator Cassidy, Dr. Dew in Louisiana, or two senators. You know, so it's tight, and he's trying to just get through this process. But I believe he'll want some scalps once he gets in, meaning Dr. Fauci got a pardon, but he will go after a company or two to send a wider message. And the Trump machine, MAGA, will approve of him targeting one or two people to send a broad-based message. A larger question that came up today, does RFK Jr. know how to deal with the budget of $1.7 trillion? He seemed to botch Medicaid and Medicare and all today. So there are people that don't think he's up for prime time for a job like this, although he's been a powerful activist, which is different than actually working in government and following the letter of the law.
So, Mark, you smile and you say he's not an anti-vaxxer. The problem is that he sure sounded like one. And it's not a coincidence that one of the people sitting behind him right now over his shoulder is Megyn Kelly. You know, he has played to these pod people and their extreme ideas and conspiracies and wanting to expose that everything is a lie and government is always bad. He played that game. The question is why and to what extent is that him or is this him?
Well, I think it's complicated. If you really look honestly, and I wrote a book called Food Fix about how to save our health, our economy, our communities, and our planet one bite at a time, where I did expose in an investigative journalistic way the nefarious ways in which the food industry and the farm industry and the ag industry undermine public health. And the World Health Organization has actually now come out with reports on the commercial determinants of health, which is how multinational and transnational corporations subvert public health and privatize profits. And that's what Bobby's talking about. It's not, burn down the house, everything's wrong, but there is something rotten in Denmark, and we have to fix it. We have to address it. And I think It's very insidious, it's very pervasive, and it goes across every sector of society, from who funds research. I mean, there's 12 times as much nutrition research funded by the food industry as there is by nonprofits or the government. They fund the professional associations like the American Heart Association. They fund front groups like the American Council on Science and Health, which is a bunch of criminals, to propagate propaganda that completely is false. They also fund even social groups like NAACP, so they'll oppose soda taxes. So they are in every tentacle trying to subvert public health. And I think they need to be held to account. They need to be brought into the conversation. They need to be actually encouraged to do the right thing. And I think this administration might have a chance. I don't know if they can succeed. There's a lot at stake here, but this is existential for our country. If we don't address our chronic disease epidemic, it's going to cripple us both from a social perspective as well as an economic perspective.
Hey, thanks for watching. Go to joinnn.com to find NewsNation on your screen. And don't forget, click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.